Hey guys, it's Louis from ndxtesting.com, and in today's video we're going to discuss what happens after you take your EMG. Now, if you want to know what happens during an EMG or how the test is actually conducted, then I'm going to link that video in the description. We're not going to spend a lot of time discussing how the test is performed because we already made a video for that. We're going to discuss actually what happens after the EMG and what results can you expect. I know there's been a few subscribers, a couple of concerns, a lot of questions as far as what happens after that EMG. What results can you expect? So we're going to kind of discuss these different components so you could be a little bit more at ease. But anyway, what results can you expect? What happens? What is the benefit of the EMG? Because if there's no benefit, then why take the test? Now remember, there's many reasons why you're going to take this test. I explained that in the first video, but we're going to go and discuss some of the clinical complaints. Now, you can have neck pain, you can have shoulder pain, the elbow could be compromised, you can have tingling and numbness in the hands, you can have clinical diagnosis of carpal tunnel, you can have lower back pain, some hip issues, knee pain, ankle pain, and then maybe pins and needles or tingling and numbness in the, especially tingling, not numbness, on the plantar. And when you have an issue at the ankle, then that's the carpal tunnel of the ankle. What's the carpal tunnel of the ankle? It's tarsal tunnel. So when you see a doctor, you're going to be examined clinically. I think we discussed that in the first video too. What kind of clinical diagnosis can you expect? Especially let's concentrate on the upper extremities to kind of keep things simple. Upper extremities will include the neck, shoulder, elbow, wrist, and just the extremities. What kind of clinical diagnosis can you expect? Now, when the doctor sees you, they're going to do a clinical examination. Okay, they're going to test your neck, the range of motion of the neck, the shoulder, elbow. They're going to ask you various questions, go over your medical condition. So on the neck, if you have issues on the neck, the clinical diagnosis that you can have it's called a cervical radiculopathy. Now, what is radiculopathy? We're going to go over that in a few. Now, let's just say also you have a problem in the shoulder. Then you can have internal derangement of that shoulder. It's another clinical diagnosis. Let's just say you have a problem at the elbow. Well, maybe you can have a diagnosis of epicondylitis. Okay, that's when the nerve is probably compromised. Or maybe you have some tendon issues or some ligament tears. It depends. So maybe you can have carpal tunnel. If you have tingling and numbness, you have clinical diagnosis of carpal tunnel. Those are the clinical indications. Now, obviously, the clinical indications, the clinical diagnosis have to match up your chief complaints. Because if you don't have any neck pain, okay, and you just go there for tingling and numbness, or perhaps maybe a little bit of pain in the elbow, then they're going to give you a clinical diagnosis on the neck. That wouldn't make any sense. So the chief complaints have to match the clinical diagnosis. And then when you have EMGs and MRIs, let's just say you have a case, then the clinical complaints have to match up the clinical diagnosis, and in turn the clinical diagnosis have to match up the clinical, the diagnostic findings, okay? When it comes to electrodiagnostic study, the EMG, okay? And then when it comes to the MRIs, everything needs to correlate. So what kind of diagnostic findings can you expect? What kind of basic results can an EMG have? Now, let's just say that you went in there with, let's just say some neck pain, okay? You have limited range of motion, you feel stiff, you can turn. But anyway, what results can you expect, okay? Again, neck pain, shoulder, elbow, and wrist. Now, we said before that when it came to the clinical examination, right, you can expect a clinical diagnosis of cervical radiculopathy. What is cervical radiculopathy? What is cervical? Well, cervical spine is the neck. Okay, that's another name for the neck is the cervical spine. So the vertebrae or the spine is divided into three different components. You got the cervical spine, which is the neck. Okay, you got the mid back, which is the thoracic spine. And then you have the lower back, which is the lumbar spine. And then after that, you have the sacrum, but we're not going to discuss the sacrum today, just the neck today, which is the cervical spine. So when we say cervical radiculopathy, that means that you have a problem, a clinical diagnosis, an issue that goes with your shame complaints. So when they give you diagnosis, they're suspecting that could be the problem. But only when you do the EMG and the MRI, only those clinical findings could be documented. So radiculopathy means neuropathy of the neck. Cervical radiculopathy means it's coming from the neck. You have an issue going on the neck. Now, where in the neck? Now, the neck is divided into 8 different nerve roots. Okay, you have like 8 different discs, 8 different levels. You have C1, C2, C3 is the top of the neck. Usually when you have a problem there, you have some issues going on there, you get headaches, okay? Sometimes you can even get blurred vision, but predominantly headaches. And then C4, C5, C6, you get a lot of pain on the mid-neck. And then from C5 to C8, towards the bottom of the neck, okay, you can get pain in the neck, of course, and then radiating into the extremity, shoulder, or the back of the shoulder, and then the elbow, maybe some tingling and numbness in the hands. Okay, so note to always remember that all the nerves you have from your shoulders to your fingertips originates from the neck. So the neck is the fuse box of the upper extremities. The way your brain communicates with the extremities is through the neck. If your neck goes, then you won't be able to do anything with your hands. The way the brain communicates with the extremities is through the neck. If the neck goes, then you won't be able to move your hands. Anyway, so what can you expect then after that? Let's just say the nerve examination is completely done. Okay, test is finished. And then the doctor comes in, tests a couple of muscles of the neck, shoulder, and the arms. Okay, so let's just say you just have neck pain and shoulder pain. What results can you expect? Now, the results can you expect if there's a problem will be, well, first, if there's no problem, it will be normal, right? Now, if there's a little bit of a problem, you can have what you call cervical radiculitis on the neck, which is a little bit of inflammation. Now, what happens is when the physician sticks the needle into the muscle and records the electrical activity of that muscle, the activity of that muscle is increased. So a lot of activity going on. Now, when it's normal, what happens when it's normal? You stick the needle in, and the muscle is nice and relaxed. But if you have a lot of pain and you have a lot of stiffness and you have a lot of stuff going on, you have limited range of motion, okay, and you can't turn, that usually when you stick a needle in there, we're going to pick up that abnormal electrical activity of that muscle. So if you have a problem on the neck, okay, and the doctor sticks the needle in there, his hand should be good. It shouldn't stab because it can hurt. But if it's good, then you don't need to go that deep to be able to see the electrical activity. You can even feel it with your hands, how maybe the muscles, maybe you have some spasms and the muscles are tight. The needle, if the physician is precise, will be able to pick up that abnormality. So radiculitis means a little bit of inflammation. Okay, now it'll tell you the level. You could be C4, C5, C6, C7. It really depends, but predominantly when you do EMGs, the areas where they can get affected is anywhere between, let's just say C4 and C7. That's the trunk of the abnormality. Okay, then you also can have cervical radiculopathy. Let's just say right in the middle, right? You have C5 cervical radiculopathy, which is right in the middle of the neck. Okay, what happens then? The radiculopathy now is a bigger inflammation. You see more abnormal electrical activity. Okay, when it's less activity, when it's not too bad, then it's radiculitis. And when it's a little bit more, then it's radiculopathy. Again, what is radiculopathy? It means neuropathy. That means a nerve. It's the neuropathy of the neck. That means a nerve is affected. The nerve could be pinch. Okay, Now, when they say pinched nerve, they throw that word like everything is a pinched nerve to these doctors, But you got to be able to document that, and you got to be able to explain that, and you got to be able to solve that, okay? Now, how can you document a radiculopathy, a cervical radiculopathy that an EMG dictates? Well, you can have an MRI. Okay. Now, depending, let's just say you have a case. If you have a workers' comp case, if you have a personal injury case, if you have a slip and fall case, if you have an attorney, then for the most part, you will need two exams to kind of point in the same direction. So if you have an MRI, what can the MRI reveal? Well, the MRI could either be normal. The MRI can reveal an abnormal curvature of the spine. Remember, the spine has a certain normal alignment. That's a certain posture. In another video, we're going to go over the correct posture of the spine. And it's important that you as a patient has good posture, especially if you have issues with your neck. And if you have a pinched nerve, or maybe your spine is a little bit compromised, it's important that you have a good posture. That kind of remind me, so I got to, sit straight here. It's important that we have good posture. And once we understand our posture, the way it's supposed to be, the way it's supposed to be aligned, we can actually work with it, okay? We can work on our posture. And it doesn't matter with 50, 60, 70 years old, we could have good posture. We could be straight. Our necks could be out. Our shoulders could be back, okay? Our lower back should be in. Our buttocks should be out, okay? Just like a model, okay? Just like a young child. Yeah, the other day I was looking at my daughter and my son. They were playing, and they were sitting down. And they're young, okay? And when kids are young, and when they sit straight, because the vertebrae or the spine is completely aligned. When we get older, then we start to slouch. That can bring some issues later on. And in fact, I'll tell you something really quick. You see how most people are looking at iPhones now? They're looking at their phones and everybody's like this. Everyone's like this. In fact, I used to work with a friend. He's a physician assistant, and he was about 6'1". He looked shorter than me, because he will always be with his phone and say, "Louis, look." And I'm like, what are you doing? Straighten up. What's wrong with you? When you're my age, when you're 40-something years old, you're gonna be like an old man because you're hunched. And I was reading an article, I don't know when, maybe a couple of years ago, and it said that the new generation is going to suffer from cervical compression syndrome. Okay? Why? Because if you're constantly going like this with your shoulders in, what do you think is going to happen when you get older? You're going to have a lot of problems. And you're going to have a couple of, the vertebrae is going to be affected. You're going to have cervical compression syndrome. So it's really important that when you're looking at a phone, just bring it up a little bit. Okay, you don't have to all the way up, but just bring it up. Sit straight. Always bring your phone up. I always tell that to my patients. Sometimes I see them like this. Straighten up. Okay? I figure I'd just throw that out there to you. The posture is really important. If you keep your posture straight, you're going to have a lot of health benefits. If you have bad posture, then you're going to have some health issues, without a doubt. Okay? So, again, what can you expect? You can, what's the average result when they do the needle EMG on the neck? Then you can have a radiculopathy. Okay, maybe in the C5, C6, C7 level, and do some homework too. Look at the vertebrae. Okay, the cervical vertebrae or the cervical spine there, and you see it. You can see all the levels: C1, 2, 3, 4, 5, 6, 7, 8. Okay, and then you can see how the nerve gets pinched. Now, when it comes to the MRI could be normal. You can have some abnormal curvature. You can have spasms. You can have a bulging disc. You can have a herniated disc. Now, those are the chief 5 results that a person can have. I mean, there's more, but those are the average that a person can expect. A person can also have degenerative disc disease, but those in advanced case studies, and we're not here to discuss that. And what's a bulging disc? Well, every level of the spine, right? Like I said before, C1, C2, C3, all the way. Every level, you have a disc in it. And inside that disc, you have a liquid substance. Okay? So what's a disc bulge? Well, disc bulge is when the disc bulges out a little bit. It's almost similar if you get a bump in your head. Okay? You're not going to have a rupture. You just have a little bump. What happens? You put ice in it, and after a while, it subsides. It's like the disc having a bump there. Okay? Now, if you have a little bit of inflammation there, and the doctor already sees, let's just say I'm the physician, and I'm the one that's conducting this study, and you have an MRI, and it's always good to have an MRI when you're going to do the EMG, because then you can have eyes. Okay? It's almost like using an ultrasound guidance. You can have eyes. So if the patient that I'm seeing has, let's just say, a bulging disc at the level of C5, then I can just go with the needle at the level of C5, pinch the muscle, and record that activity, and I can see the level of inflammation there. Now, again, I'm not a physician. I'm a technologist, and my specialty is the peripheral nervous system. I specialize in nerves and muscles. I assist in the performance when I work with doctors, physiatrists, neurologists, when it comes to the EMGs, but I specialize in the nerve examination. Obviously, I'm there anyway, with the EMG, just make sure that these doctors are doing what they're supposed to do. Anyway, so, and then when it comes to a herniated disc, what's the difference between a herniated disc and a bulging disc? What happens is with the herniated disc, remember that liquid substance that I was telling you about, the disc kind of ruptures. Okay? And it ruptures, and the liquid comes out, and it creates a level of inflammation. And then inside that disc, you also have spinal nerve roots. Not inside, it's outside, my bad. And then that inflammation, okay, has a tendency to compromise it, of pinching the nerve. So when the doctor goes in, they can see that pinch. They can see that how that nerve is affected, how bad that nerve is pinched. So obviously with therapy, with physical therapy, with limited range of motion that you have, you don't want to go crazy now, moving your neck all over the place. You don't want to go to great adventure, start going on all these rides, and now you just want to take it easy. Then the inflammation subsides. And, the disc kind of finds its position again. You're not going to have pain forever. I mean, obviously in severe cases, then you can have surgery, but that's only in severe cases, So the EMG will be able to tell you if you have a radiculopathy on the neck. The MRI will be able to tell you if you have a bulging disc or a herniated disc in your neck. Those tests should be conducted together. Now, obviously, when it comes to the shoulder, it's a different situation. If you have an MRI on the shoulder, then you can have a rotator cuff injury. It depends on your limited range of motion. You can have a tendon tear, the supraspinatus tendon, or maybe the infraspinatus tendon towards the back. You can have some ligament issues, tendon issues, like I said before, rotator cuff issues, And then when the doctor goes in there with the needle, they can pick up a little bit of inflammation. Let's just say you have an elbow problem, and you have pain at the lateral part of the elbow. My bad, not the lateral part. Lateral part's on the outside. The medial part, the inner part of the elbow. And you have tingling and numbness in the last two fingers, or even in the thumb. You can have a clinical diagnosis of epicondylitis, okay? And so in diagnostic terms, then what happens is that means the ulnar nerve could be affected. Now, the ulnar nerve at the level of the elbow, okay, is very superficial. I can make an incision and pull it out. That's how superficial it is. So what happens is with these nerves on the front line, they can get compromised. Okay, so when I do the nerve examination, I can see if that nerve is compromised or not. So one of the clinical indications is pain in the elbow closer to the body, not the outside of the body. If you have pain in the outside of the elbow, then that wouldn't affect the ulnar nerve. Okay, so like I said, pain in the elbow, and then tingling and numbness in the last two fingers, and or the thumb. So the nerve examination will be able to tell me if that nerve is compromised. When the doctor goes in there with the needle, there's some muscles that will be able to tell the doctor too if the muscle is affected. Then if you have an MRI, the MRI can tell also if the nerve is affected. They'll be able to tell you if there's any ligament tears or tendon tears. Now I want you to know this too. Okay, especially when it comes to shoulder, elbow, and wrist. So when you get an MRI of these components, right, we're going to look at 5 different structures. So the MRI will give us a view on bone structure, ligament structure, tendon structure. Okay, those are the main 3. The EMG is going to give us information on the nerves and muscles. Now, not everything is going to be affected. You can have abnormalities in all 5 of them. Sometimes you do, but rare. Maybe sometimes the nerve's going to be affected, muscles okay. Maybe the ligaments and tendons are okay, or sometimes vice versa. Nerve is okay, muscles are okay, but you got some ligament tears. Okay. And then also another thing you can expect too is you can have carpal tunnel issues. Okay. The nerve examination is the chief test when it comes to diagnosing carpal tunnel. In fact, the EMG, the needle part, has way less value. The nerve examination is a test of choice when it comes to nerves, when it comes to carpal tunnel. Okay, I'll know instantly as soon as I test that nerve if the patient has carpal tunnel or not. Another thing that I want you, there's so much information. I'm already going overboard here. I'm going to have to edit this. I have 27 minutes on this video and I have like 11 minutes on the other one. I can't make this video so long. I'm going to probably bore you guys to death, but I'm trying to give you guys as much information as possible, but I'll make another video kind of simplifying this. But anyway, we'll leave it at this for now. I think that I put too much information, and hopefully this video has been helpful. We're going to do more and more. Next time we'll discuss the lower extremities, a little bit more. If you have, questions, I know that maybe what I've discussed, it's not going to pertain to everyone. Maybe people have questions regarding the lower extremities, but at least now you have an idea of what to expect. Okay, and I'll see you in the next video. We have a lot of topics to discuss. I really want to apologize too. I mean, it was a long time. It's been a while since I took out a video, but we were trying to see the direction of this YouTube channel. At first, we were going to concentrate on electrodiagnostic education for technicians, but I see there's a greater need when it comes to patient education. The electrodiagnostic education for technicians will be more on the back end, but patient education, patient health is going to come first in this channel. We're definitely going to educate you so you can be as healthy as possible. And another thing too is to teach you how to use preventive measures so you can be healthy, so you can take care of your body. And I'll leave you with these 2 things. The body is composed of 2 major highways: the peripheral nervous system and the cardiovascular system. The peripheral nervous system is composed of nerves and muscles. You must, by all means, keep that healthy. Okay? Every single nerve you have in your body, or every single muscle you have in your body, you have a nerve attached to. If you keep your muscles healthy, then your nerves are going. That motor nerve attached to it is going to be healthy. The cardiovascular system is composed of veins and arteries, or arteries and veins. Okay, you must keep your arteries and veins healthy. Okay, you do that, and you're going to live a long, prosperous life. And we're going to have more health topics on that, more advanced diagnostic technology. This is the beginning of new digital health communication, and I'm going to work hard to bring as much of this information as we can. But please subscribe, turn on your notifications so you can see when we take out videos, and we're going to try to do that now once a week. We know pretty much the right format now. We didn't want to just take out videos just to take out videos. We want to take out videos that can make a difference, and we think that we can do that now. I'll see you in the next video. Bye-bye.